Good evening. God bless you, everyone. Thank you for joining us this evening for a session tonight. I know we are normally used to having our prayer and Bible study, but we put that on pause because we're in the midst of a pandemic. We haven't fully come out yet. And we want our people to know, our church, our community, and we're not talking about just our local church. We're talking about our church community, as well as African Americans, and so on. That everyone will be educated, informed. That way, they can make a decision whether for or against. But they will be informed. They will know what decision they can make, and it won't just be by hearsay and so on. But we are blessed this evening to have you on, and we're grateful because we have received information. We're going to receive information, and we're glad to have um, a dear sister to us who we know her name is Evangelist. She's an evangelist, but not more important. That's most important. She's a child of God. It's most important. But this woman of God is a certified nurse practitioner out of San Diego, California, by the way of Philadelphia. She's been working in the healthcare industry for quite some time, covering different nursing jobs and functions, capacities, where included in Philadelphia, included the Thomas Jefferson, well, that's where she got her Bachelor's of Science from the nursing program at Thomas Jefferson School of Nursing, but she's worked at the Women's Medical College, Temple University, Albert Einstein Medical Center, the Hospital of the University of Pennsylvania, and that has caused her to go even to branch out from the Philadelphia. She's Philadelphia, from my understanding, born and bred. She can correct me, amen. But she's from Philadelphia, but God has allowed her to launch out and spread her wings and fly. And she's coming also by the way of Atlanta, and finally she worked there and did some great work there. One of her greatest success came from working with the Medicaid program in Georgia, where she created and introduced a high-risk obstetrics case management program designed to prevent preterm deliveries and reduce NICU admission for the poor and underserved minorities. And so, she's went on to fulfill her studies when she moved to San Diego, and is have become and she accomplished this. She became the great nurse practitioner. And if anybody knows, a nurse practitioner is one that is very, very, it's a thin line between the nurse practitioner and the doctor. So some of us, including myself, have went to the doctor, and what has happened? We expected to see our doctor walk in. And who comes in? It's the nurse practitioner. And they know you. They know you inside and out. And we just really, I'm not really doing her justice, but right now, she's in her doctorate, pursuing her doctorate in nursing practice degree. And she has done and is doing great things for our communities, for the African Americans, for U.S. citizens, as well as immigrants, and so on. And so we thank God for her being here. She has background in the gynecological and family medicine, so she's just all around. She knows her stuff. All right. So we want to welcome tonight and introduce to you all our dear sister. I say our because we're connected through the blood of Jesus Christ. And we just appreciate her. Nurse practitioner, I'll give her official title today. Nurse practitioner Joanne Good, also known as the Evangelist. All right. She's coming in, and we praise God for her. All right. All right. if you, I know I gave somewhat an introduction, but if you just want to introduce yourself even better than I could, you're welcome to do so.
Good evening. All of those things are not nearly as important as the task that we have at hand for tonight. I am the daughter of Bishop Raymond Milburn, and I am also an evangelist of the gospel of Jesus Christ, and I am also a family nurse practitioner. I have worked in this industry from the 90s to current. And my goal, my objective, my passion is ministering to God's people, minorities, underserved people, to make sure that we get the information, because I think that there's so much misinformation out there. There's so much bad history and so many examples of times when we weren't afforded the opportunity to have access to the best. And so my objective is to make sure that we get access to the best. And because I am blessed by the best, I expect to give the best to our people. So currently, I am the originator and leader of the health and wellness ministry at New Vision Christian Ministries, where I attend in San Diego. Um, what I do there is education. I also visit the sick, minister to those when they get home from the hospital, making sure that they have everything that they need, and various questions that come at 2 in the morning. This is what's going on. Can you tell me what I need to do? We don't charge anything for those services because we do it as unto the Lord. So I'm just so grateful and humble that I was asked to be a part of this, to be able to answer as many questions as I can, and make sure that we have the proper education. Because, as you said, informed consent is what it's all about. We need to make sure that we have the information so that you can make a decision whether it's going to be for or against.
Amen. Well, we want to again welcome you this evening, and we appreciate evangelist, our own evangelist, Tia Campbell, making, suggesting, and hearing from different ones their concerns. We thought it would be only right to come together and actually have a conversation that many of us have had privately, but um, privately, but we haven't shared that openly or publicly. Whereas, whereas some things we have said, and we don't want nobody to know we said it, or we haven't been bold enough, or just haven't had the um, connection or the person to talk to about that, and to get more confident um, information, because there is a lot of bad information out there, and when that information is going out, people have dreamed up a lot of things, and so we know that this pandemic hit us, and it hit us, and it hit us hard. Over 573,000. I don't know what the latest tally is, but to have that amount of lives lost just in the United States, it is shaking. It causes your whole world to shake, and some of us, or all of us, know somebody, or know of somebody that was related to somebody that lost somebody. Even this last week, as much as the vaccines are going out, there are things that are not, excuse me, happening fast enough. And a young man who's dear to the music industry, especially gospel, here in Philadelphia, a musician, he passed. And we thought he was going to pull through. Matter of fact, I thought he was older than me, but I'm older than him. And to know, 41 years old, uh, previous conditions, and still didn't make it out. With the vaccines being here, not sure where he was, but it just causes us to have, to really, we need to keep opening this dialogue, having this conversation, because it's needed. So I don't want to keep talking. I want you to do the talking, but I do have some questions, or if you want to start off.
Well, I just really want to say initially that, us here in the United States, we're self absorbed in the regard that we think that it is happening just to us, but it's not happening just to us. This is a global issue. And we have to think outside of the me and mine and think of us. And that's where the vaccine comes into play, because it's not just about what's going on in your four walls, your husband, your wife, your children. It goes beyond that into neighborhoods and communities, cities, states, worldwide. And so when you think about, should I get vaccinated? I'm healthy. I'm young. Um, I know Jimmy over here who got COVID and he didn't have any symptoms or he recovered quickly. It's not just about us, and we have to stop being so self absorbed and thinking it's just about us. When I think about myself, especially before the vaccine, I did not see anyone. I didn't go anywhere. I didn't do anything. Not because I was afraid I was going to get COVID, but because I thought that I could spread it. And that's what the vaccine is about, preventing the spread. Not really about because I could have COVID and not have any symptoms, but spread it to someone. Go visiting a mother at the church or someone who is compromised, and unknowingly spread it to them. And that is the thing that's most important about being vaccinated and following the guidelines, wearing masks, washing your hands, social distancing. It's not just about you and your household, it's about your exposure to other people and how quickly what is minuscule to you could be devastating to someone else.
Right, because now we have the variants that are spreading much faster, much quicker. And we have taken many have taken for granted. Sometimes I can take it for granted, and we'll go about not thinking. We looked at the beginning of the pandemic, we said we survived it. Now let's keep doing the same things. We start scaling back. So I'm fine. I survived this long. I'm fine. What do you have to say to that?
Well, if you just think about this is a virus. So I know that you had asked, you sent me a couple of questions, and I just maybe touch on it. This is a virus, and viruses mutate, just like the cold is a virus. You've had one cold, you've had 100 colds. You never get the same cold ever. It is a variant of any particular virus. So while the variants are new, the research is suggesting, specifically with the Moderna virus, the Moderna vaccine, that it is effective against the South African and the Brazilian, South American variants that they have. They're doing the research on that, and it seems to be showing favorably. It's very new. So there are no definitives. This is science. It's very new. There's nothing written in stone. All we can do is go by the evidence and what the evidence is showing as time progresses. So only time will tell.
Gotcha. Gotcha. Well, we're going to start. I know you dabbled a little bit with that, but we're going to go into the questions because we wanted to make sure that we got to hear what different ones were thinking, how they were feeling, and so to kind of have a direction and not just spew out a lot of details. But there has been amongst our African American community, there has been a lack of trust. Can we trust this medicine, a vaccine that only took approximately 9 months to come up with?
I think that we can trust it. And the reason why I think we can trust it, and it's been 9 months for this particular vaccine to come out. That's the time it took. But The science behind it has been out for a little bit longer, several years in actuality, and they've been working behind the scenes to use this technology for different viruses such as Zika, cytomegalovirus. There's other viruses that they've been trying to utilize the science for it to help to help those viruses, HIV as well. So because of the variants, that's been the challenge in getting vaccines developed. But this science has been around for many years.
So that brings me to a question. Um, I guess the next question is, how long has infectious diseases been researching the coronavirus?
Well, the coronavirus, as we know, this is SARS COVID-19,
Pause,
which
pause, pause. You mean to tell me
this is a SARS virus.
that
Because what SARS means is it only means severe acute respiratory syndrome. There have been many SARS like viruses since the development, since its onset, and I believe it was 2003 or 2006 the first SARS virus became known, and it became known from China. So this is not the first SARS coronavirus. This is just the SARS coronavirus of 2019.
gotcha. So what people have been seeing, because there was a craze when we would when we first came into the pandemic, and we were limiting our going out, but we were going out when we would go to the markets, when we would go to the wholesale stores, we were going for the cleaning products, and one of them was the good faithful Lysol, and people discovered and said Lysol has been what some people had not, I'm sorry, not discovered, but had stated when this crazy, you could hardly find it, was saying coronavirus have been on the description of Lysol for years.
There is actually a coronavirus vaccine for dogs. Coronavirus has been affecting our animals for a long time. Just not this version, but coronavirus is not new. It's just that this particular strain is new and what's challenging us because of the way it is affecting humans.
Wow. 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 So, how can we help reduce the fear in the African American community, and as well church, of course, given the historical disparities that we've been dealing with? There's a lot of, well, they trying to kill us out. They're trying to
Well,
kill.
I'm just going to say one word, one name, Dr. Kismikia Corbett. I'm not sure if anybody knows anything about this
Yes,
young lady,
she's phenomenal.
but she is essential in the development of the Moderna uh, vaccine.
Wow.
She's an African American immunologist. Um, and that makes me proud, but it also gives me some confidence.
Right.
I know that we have so many fears about the past atrocities that have been done against
Right.
Black people when it comes to science, when it comes to medicine, and I have studied that, and part of my thesis in my programs have been around the disproportionate disparities in healthcare among African Americans. Why is that? We don't have enough doctors that look like us. We don't have enough dentists that look like us. We don't have enough uh, immunologists who look like us. And we are not included in the making of the development of medicines, treatment plans, specifically for us, because we don't exist in those rooms. And so part of the thing for me is getting us into the rooms where the research is going on, where the science is going on, to be included. So your answer is, how do we help, for people like me, and if we can get doctors, and nurses and healthcare professionals, to get involved in the community to make sure that, we champion these kinds of efforts. I'm fully vaccinated, have been fully vaccinated since the beginning of February. And everyone, that I'm in close contact with, as soon as they were eligible for the vaccine, I made sure that, we got them vaccinated. And I think that, it really is just, we have to do this not only for ourselves, but for other people. And again, we're going to trust God, because that is really kind of where it goes down to. If you think about, any of the, um, diseases that have been eradicated because of vaccines, we know vaccines work. The only way they work, though, is if we get vaccinated.
Right. You have to take it. You have to get vaccinated in order for it to work. It won't look like it will work. You can have all the ideas about it, but I'm glad, I'm glad because me and my family have just gotten our first shot, and so we just got ours yesterday, and
How's your arm?
my arm is okay. I did not go to physical therapy today because I didn't want to extend my arm, but I will say this: it's not bad as the flu shot that I once got. Now, to
Okay.
me, this is different than the flu shot.
It's
The
totally
flu,
different.
yeah,
And the reason it's different is because it doesn't contain any virus. So when you get the flu shot, they actually give you a killed version or a weakened version of the flu. But
right.
this vaccine doesn't have any of that in it.
Wow. Now that's good to know. That is good to know. Someone asks in the comments section. This is not a question that I was able to pose to you before time, but this is a question that I've heard somewhat about, and they ask, "Are you familiar with the mRNA?"
Messenger RNA, that is what, is the driving force behind the vaccine. So messenger RNA, um, it's synthetic proteins, that have been coated with the DNA of the virus. And what it does is it sends a message to the cells that you should develop antibodies against this protein sequence. Once the message has been delivered, it's kind of like ripping up a piece of paper and it gets discarded. So, messenger RNA, mRNA, delivers a message. Scientifically, it's really kind of complicated, but it
Mm-hmm.
delivers a message to the cell to develop an antibody against a protein. And it is the protein of, um, of the novel coronavirus 19 that it has been charged with.
Okay.
Once the cells take in the message, they develop antibodies against it, and that is why, this vaccine is so different from any other vaccine, because the other vaccines actually introduce the virus to you, and it's up to your body to develop the immune response.
Got you. Got you. So does this the next someone made a statement saying a popular thought is that the vaccine will alter or change your um, mRNA, or is that related to the
So you
DNA?
don't have mRNA. People don't have messenger RNA. Messenger RNA is synthetic. The what I've heard, in one of the uh, misinformation that's going out, is that the dropping off of the message will alter your DNA, and that is not true.
Okay. Got you. Got you. Thank you. Someone asks, is the Moderna only good for 6 months?
We don't know. Pfizer just released, some research that suggests that boosters will be required, and that's Pfizer. So we don't know about the Moderna vaccine, but we do know that after being immunized with the Pfizer vaccine, some of the antibody or the antibody load does decrease. So a booster may be required.
Okay. I'm gonna go to a question. I'm gonna come back to the live questions because the questions are coming in seemingly. So I'm not sure from your screen if you could see them. Um,
Nope.
but nope. Okay. All right. So I'll make sure I get back to that question. But here's the next question as well as the statement. The question that was given is: there are many who never intended to get vaccinated and have been socially distancing. I'm sorry. Let me correct that. There are many who never intended to get vaccinated and have not been socially distancing. Since there is potential, although minimal, of getting COVID even after being fully vaccinated, why is it now okay to take the mask off outdoors, especially with other variants out there? The statement that came followed that is the CDC keeps changing the limits like distancing. It was 6 feet minimal for a year. Now it changed it to 3 feet in the classroom, and now children are getting sick. Restrictions with masking have also been relaxed. It seems like it's too soon, and the CDC only changed things because the pressure to get them back to normal.
Okay, so two parts to that question. The first part is I know lots of people never intend to get vaccinated, and you've just been very fortunate not to come in contact with someone who has the virus. So people who've been, I'm going to say, irresponsible and not social distancing and not wearing masks, and just doing their normal behavior, they have been very fortunate and very blessed not to come in contact with the virus. Or they did come in contact with the virus and were asymptomatic, and we'll never know. And in them being asymptomatic, may have passed it on to someone who actually got the virus. So these are the things that we don't know because initially younger people were considered carriers because they were asymptomatic. Um, or they had, the symptoms from the very beginning were so varied. And yes, other things still exist. Yes, people still have allergies. Yes, people still get common colds. Yes, the flu still happened this season, but the focus became COVID. So people were afraid to take their allergy symptoms to the doctor for fear of being identified as a COVID person. So there are so many things to play into part to people who say they haven't been responsible and haven't gotten COVID, and so they're fine. The second part of that is yes, there's lots of pressure um, from this capitalist society that we live in to get things back to normal. Um, the CDC released some information yesterday suggesting that if you are in a group of people who are fully vaccinated, you don't need to wear masks. Also, if you're outside in the open in small groups, you don't need to wear a mask. I had not heard about reducing the distance because we know that coughs and sneezes, particulates travel. So I'm not sure if I've heard or read anything about decreasing the distance. But we do know that if I'm wearing a mask and you're wearing a mask and we're 3 feet apart, the mask is doing their job. So if for children who are both masked properly, is 3 feet sufficient? Probably. Um, so, if you're out and about and you're out in the open and you're 6 feet away from people, do you need to wear a mask? Conceivably, you should be fine. Um, but yes, there is a rush, I believe, personally, to get things back to normal. We need to slow walk it, even though we have millions of people vaccinated fully, we still, it's still a drop in the bucket, and we definitely need to get to about 70% before we reach that quote unquote herd immunity, and we're about 30% right now of fully vaccinated people. So we still have a long way to go.
So that means we can't just think just because we did not have it,
That you
and
didn't
let's
have it.
think you could have had it and been
Right.
asymptomatic. But you cannot think because you didn't see the symptoms, and because you come to this place and now we have people getting the vaccine. Now I can relax. I can take
Hmm.
off my mask. I can do such and such. I can,
No, because the thought is that even vaccinated, even when you've been fully vaccinated, you can still contract it. However, the it minimizes the virology of it, and it also minimizes the complications. So just like if you got the flu vaccine and then you ended up getting the flu, it's not nearly as bad as it would have been had you not been vaccinated.
right. All right. The question came in. I think this is maybe a good segue into this question that came up on the line. Um, I'm gonna jump in first after asking the question because I want to come from another angle and then come back to you so you can answer it. The question is there any reason why the homeless population haven't succumbed to this pandemic? From my point of view, first I would need statistics to know if the homeless did not succumb. That's first. Second part of that, to the first part, is I'm a former instructor with mental health first aid. One of the things we teach is about the comorbidity and all of these things, and having dual diagnosis and such. And when you talk about that, and I'm no expert, but when you talk about the mental aspect, when we talk about mental illness is often the statistics that we see that come from mental illness normally doesn't include those who are incarcerated and those who are homeless. And so um, I will even go far as to say the homeless, some of them have been possibly affected um, because the idea is even with um, there's a ministry here called Chosen 300. Chosen 300 had to shut down once. And this, you talking about a ministry that's feeding the hungry day in, day out, every day. But they had to shut down because at some point, the director, who's very hands on, received, contracted COVID-19. So to look at the homeless, I would need more information. I would need to know that they weren't included. And we would have to look at the data to see if they weren't included, to say they didn't succumb to it. And then, secondly, normally, and I'm repeating this, normally they're not included in statistics. We miss that grouping. We because they don't have a home, they don't have insurance, and all those things. So a lot of times we just don't hear about it. That's just my point of view, but
That's definitely true. Definitely, there's no catch all. There's no here in San Diego. What they did do was round up the homeless, and they housed them in vacant hotels.
wow,
Everybody who wanted to go. You have some mentally ill homeless people who did not wish to go. And yes, there was a large population of people from the homeless people who did contract COVID and also died.
wow,
So, and we have that data here in San Diego because we have a large homeless population, and that data was definitely collected here. But you are right; most often, homeless are not included.
yeah. Unfortunate, but they are a lost part of our society. Lost part of our society. Next question is, when you receive the second vaccine, you can feel fatigue more than you have before. Uh, when is this? I'm sorry. Is this a side effect? If so, will it get better?
Um, so some people, not all, have more severe uh, adverse reactions um, after the second shot. And I say adverse reaction, not side effect, because the side effect is something that's going to be life threatening. So you can't breathe. You have a local reaction, meaning your arm swells up, it gets red, it gets hot, that spreads, it becomes an infection. You have tachycardia, you have some kind of, those are side effects. We have an expected immune response to any vaccine. So people who get a second vaccine in some cases have a really great immune response, meaning they get fatigued. It lasts 2 or 3 days. They will get. I've had patients complain of joint pain because it's an immune response. And so it lasts 2 or 3 days. Um, People will, be tired. It'll last 2 or 3 days and then it resolves on its own. When I got my second vaccine, and I did get Moderna, um, I felt like I got tired at work. I was here at work, um, and I got a headache and I got tired, and I said, I'm going to go home. And the next day, I felt like I had like a cold. And then the next day, I was fine. So it's an immune response. Your body recognized it because its job was to take the message off the RNA and
Mm-hmm.
develop that protein and to develop immunity to it. So when you get introduced to it the second time, your body has an instant reaction. I'm going to make antibodies to what just happened to me. And so that's actually a good thing when you have that kind of response after the second dose.
Okay. So the question has come in um, regarding what is the difference between RNA and DNA?
Uh, I can't explain that in 5 minutes. I can just tell you that
Okay.
DNA carries the genes. It's double stranded, and it carries genes that make cells that make you. It's coated with everything that is necessary to make you. Uh, RNA is a a part of cell structure. It's single stranded. It's made of proteins, not genes, and it supports DNA. That's the quickest, most non-science, most benign scientific, without going into a 2-hour lecture, that I can give you.
I got you. I got you. All right. The next question it is, what evidence supports the need of young adults, teens, to get two shots as opposed to just getting one shot to allow their stronger immune systems to do the rest?
Um, when you hit me with that question, I kind of looked it up because
Mm-hmm.
I really can only tell you that the science and the research was done on two vaccines and the way that it's dosed. So whether or not someone with a weakened immune system or a stronger immune system needs two doses, grandma needs two doses. She's 90. I'm 40, 49. I need two doses. The 35-year-old also needs two doses. The teen who's 16 and over needs two doses because that's the research. Is it possible? Sure, that they may, but the research hasn't been done on that. The research has been done on two vaccines.
Got you. Okay. The next question um, is that has come in. If you have the antibodies, do you necessarily need to get the vaccine?
Yes, because the natural antibodies are waning, so they don't last long, um, and that's the reason for vaccines. So, um, Yeah, you definitely need to get the vaccine.
So the antibodies only last a little bit of time
Right,
after having been introduced to the COVID-19.
right. That's why we've had many cases of people getting COVID twice.
If after testing positive for the virus and quarantine for 14 days and still test positive afterwards, are you considered no longer contagious?
Yes, and the reason that is because how you are tested, especially if you do a PCR where they do the swab up your nose or in the back of your throat, it just detects the virus. It can't tell you whether or not the virus is active or not. It just detects the virus. So I could have had COVID, did my 14 days, I'm symptom free. They swabbed me a second time, and there are still virus present, whether they're active or not, and it will pop a positive test result.
Okay.
So no, you're not contagious,
So you're
but
not contagious?
not contagious.
Not contagious. Okay. What does immune response mean?
Okay, so when I had this conversation, you're my age, so I don't know if you ever remember the cartoon The Muppet Babies. They did this really great
Yes.
episode where Kermit
Gonzo
got
was one of
sick
my
and they shrunk
favorites.
themselves and went on orange juice and fought the germs. It was really cute. But when I think of an immune response, that's exactly what I think of. Your body recognizes an invader, and all of the white blood cells or get together and they seek out this thing that doesn't belong. An immune response comes in the form of a fever because um, uh, pyogenesis. It's what your body does. It heats up to kill a virus. So we're always trying to stop a fever with Tylenol. It's probably not the best thing to do because your body's natural response to an invader is to heat up to kill it. Um, and that takes energy. So that's why people have fatigue. So these are the way that your immune system responds to an invader. It heats up, you get a fever, you're tired because your body is working really, really hard. And that's what an immune response is.
Awesome. Awesome. Um, I believe the other question that has come in, I did ask that question. Someone stated, excuse me, someone stated, they said, in February 2020, there was an interview on Good Morning America, and quote unquote, they stated that they, as in all the experts, clearly proclaimed that a mask would never work, even to the extreme that the virus would intensify. What changed? What changed? I would say from my perspective, and most certainly I know you'll answer this much better than I could. What changed was information, testing, people. You could not have this information. They're going off of what they have encountered and lesser serious strands than the strands and variants that we've seen coming into 2020 and throughout 2020 to now we're in 2021 dealing with much more aggressive strands. What changed was people. Even people going out. Some people don't want to stay in, so they go out, and next thing you know, now it's still spreading. Masks have been proven to slow it down, which is why they're saying now that because of the vaccine, and again, this is a work in progress. Now the understanding is you have the mask, so with the mask, if you have the vaccine and you've been fully vaccinated, now you can get around those that have been fully vaccinated and pull your mask down. Now, me personally, I still don't feel that comfortable. I'll pull it down and get some air, but I'm putting it back up because I'm not comfortable. I think time, information, testing, seeing what this is all about. I know people that personally was working for pharmaceutical labs that had went back to work. They're retired, and went back into the lab. They were called back into the lab because of this coronavirus, COVID-19. Let me say that better, because coronavirus, again, has already been around. So we've seen it when SARS came. We've seen when we look at China and other countries how they were masking, and we were like, wow, we just believe we would never go through that. And here we are in America, and now we're dealing with masks. But I'm sure you can say better.
Well, again, it's science. In February of 2020, we did not have a full understanding of what we were working with. Was it a contact virus? Is it airborne? Is it droplet? There's so many modes of transportation. So in February, the experts who knew very little about this virus went on what they knew, which was very little. So with time, we do know that it is spread by droplets. How do droplets spread? Saliva. So when you're talking, you have what's called insatiable water loss, which is why wearing a mask is very important, because even though you may not appear to be having spittle come out of your mouth, you are. When you breathe in and out of your nose, you may not appear to be releasing anything, but you are. It's micronized, and because it's so small, it lingers in the air. That's why masks are very important. And so a cough propels that. It's an accelerant. It propels the spittle. It propels it. A sneeze propels it further. So that's why wearing a mask is important. It covers your conversation. It covers your cough. It covers your sneeze. It prevents those particulates from getting into the air. The best way to do that would be with the N95 mask, because it protects up to 95% of particles, down to a cloth face covering. I take something better than nothing. I take a cloth face covering to prevent my cough and sneeze definitely from going out. And if I'm wearing a mask and you're wearing a mask and we're 3 feet apart, there's no particulates coming out of the mask, and that prevents both you and I from getting sick. So what's changed? Science, time, information. That's what's changed.
All right. Next question. What kind of question, kind of compound together. They put this vaccine together too fast. You can't trust it. How long has this virus vaccine been worked on?
Well, we talked about that a little bit earlier. So it was put together really fast. We've had people from around the world working on this. It wasn't just the United States scientists working on it. It was scientists globally working on it. And so I would kind of suggest, even infer, that with so many scientists working together, it was equivalent to many years. Although it was just 9 months before the vaccine, was put out. It's not that the research has been there for many years with this type of vaccine, has been there for many years. COVID or coronavirus is not new. SARS is not new. But just this particular strain that came out in 2019 is new. That's why it's called the novel new coronavirus 19. And so the science behind the vaccine has been in place for many years. But Operation Warp Speed comprised of scientists from around the world working on this, because this is not just about us here in the US. This is about the world. This is a global pandemic. And I really want to reiterate that we need to stop worrying about just me and mine and what's going on in my house, and think about communities, cities, states, the world.
All right. Thank you. I know we covered that they put the vaccine together too fast. You can't trust it. Again, that comes with the knowledge and understanding. And again, Dr. Kazmikia had a conversation with Bishop T.D. Jakes a few months ago, and it turned on the light because I was on the fence. I was Pfizer, Moderna, and Johnson and Johnson. I won't say what I said about Johnson, but I just will say, I just will say that with the vaccine, I found out during this time that I was like, oh, I didn't know there was SARS. If that's the case, this information is just another branch. It's just extended information. But this research was all along, so I'm not afraid to, because that's all right, not to over spiritualize, but that's how Satan works. He takes misinformation. The Bible tells us, "My people are perish for the lack of knowledge."
That's it.
So if we don't get the right information, we're going to be led astray. That's why we need to be in prayer constantly, so we can know which direction, so our discernment will kick in. And if God is saying this and allowing this information to come, we're able to come to an educated decision, whether for, like we said at the beginning, whether for or against. This session is not to say, hey, you better go get your vaccine. It's not to say, don't you better not go get that vaccine, or you better get that. This is not that session. We want to make sure everyone is informed. Now, yes, I have received my first shot. Received my first shot yesterday. All I have is the pain in the arm. I think that's been it. Everything else is normal. I suffer from sleep apnea, so I'll go to sleep in a moment. So I can't say fatigue. I can't say anything. If anything, I probably walked and was extra today, extra chipper. But yes, I'm gonna get back to this question. So this next question is: the previous administration claimed. Talking about the White House, the previous administration claimed he wanted to always play it down, referring to COVID-19, and directed others in his cabinet to do the same. They all played it down. And then at this point, can we trust what the CDC says? And I think that kind of goes on the tail end of what we talked about earlier with the CDC keeps changing. From the different dynamics. Again, more information is coming in. So more information is coming in. You have more statistics. You have more data. The data is very important. Data is very important. If people don't believe, and I'm saying this very clearly, so future doctor, I'm not going to put that burden on you. I'm going to say it today. I'm going to say numbers mean something. Data means something. God is a God of order. He's a God of strategy. And if he's a God of order and strategy, he knew that data was going to be very important. If that was the case, he wouldn't have a book called Numbers. He wouldn't even told, Moses not to number. I think it was Moses or David. I can't recall. But told one of them not to number the men. And they went on and did it anyway. All these things. If strategy and data wasn't important, we wouldn't need numbers. We wouldn't need no statistics that's in the Word of God. No dimensions of the temple or tabernacle. But can we trust what the CDC says?
Information is ever evolving, specifically based on just what you said. Um, we have over 500,000 people in the United States who have died from this disease, this this virus. That's not a global number. That's just here in the U.S. And we're talking about a second and third wave in other countries. But we still have some countries who have no coronavirus, and that's because they immediately masked up, they immediately social distanced, they closed down their capitalist ventures. People stayed home, they restricted their borders, and they are now, free of COVID. And had we done the same thing, had our previous administration taken it seriously, called it what it was, uh, then we wouldn't be here today. I can 100% with every fiber of my being say that for sure. Had the previous administration um, just done the bare minimum, which is making national stay at home for 1 month, we would not be here where we are. Had the borders been closed from all travel, from I don't care what country you were from, just for a short time, we wouldn't be where we are today. So we can't turn back the hands of time. It is what it is. We have to deal with what we have to deal with right now. And right now, the priority is going to be to continue to social distance, continue to wear your mask, continue to wash your hands, but most importantly, to get a vaccine. Um, that's my medical recommendation. That's my personal recommendation. That's my spiritual recommendation. I think that it's going to be the most important because it's not only about us. It's not only about my house. It's about my neighbors, my church community, my neighborhood. I can't express that enough because I don't want to be the reason why um, Mother Joe at church gets COVID and dies because
Right.
I exposed her without knowing that I was infected,
Right.
and that is what's most important.
Indeed. 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 Someone, because I can go on a little bit further. We have a few more questions we're going to take. Maybe about, I see one and I see 2/3, and if no more comes in, that'll be it for tonight. Because the administration um, will be speaking in momentarily. So, um, the current administration. So I would say everybody's response to the vaccines are different. So, where you have some will have a headache, some, you know, stretched out after the first shot. Everybody's different. Everybody's different. Everybody's body is different. So you can't just gauge it off what one person had and think that's going to happen to you. Someone told me, stay hydrated. Well, I think that's what we normally should do. Someone told me stay hydrated. Well, I didn't stay as hydrated, I think, to my knowledge, but I didn't walk away with a headache or anything. So, only reason I think I'm sniffling now uh, is because I got the air on and it's hot. So, but this is one of the last few questions that we're going to take tonight. My coworker was fully vaccinated and her husband contracted COVID. 2 days later, she tested positive for the virus as well. Quarantined for a week and returned to work. What does the vaccine do if you can be fully vaccinated and still test positive? Was the quarantine for her safety or ours? Just from
Okay.
my understanding, I'm going to keep mine brief because I need the practitioner to talk. But my understanding is with the vaccine, when you have the vaccine, it does not make you, it does not keep you from getting the virus necessarily. It will keep you from having the worst the worst when it comes to COVID-19. It will lessen depending on uh, the vaccination, but also I would believe that the vaccination would take time as well. So if they were asymptomatic and didn't know and all that stuff, but let the professional respond.
Okay, so when that individual was fully vaccinated, it really depends on when she was fully vaccinated, because it takes 2 weeks after the second vaccine to be considered, fully covered. With that being said, what the COVID vaccine does is it prevents the severity or decreases the severity in any instance that you do contract COVID. So if you did get fully vaccinated and within the 2 week time frame become contacted or contract the virus, you would have a immune response, of course, but you're not as infectious, and the insult is not as harsh as it would be had you not been vaccinated. So it decreases the severity of symptoms, shortens the life of the virus, and that is the reason why it prevents transmission. So that's the reason why getting the vaccine is going to be very important.
All right. Uh, that second part was the quarantine for her safety or ours?
Oh, the quarantine was for your safety. Again, depending on when she got the vaccine. Not sure if it was in that 2 week time frame or not, but definitely anyone who has coronavirus or become in contact with someone with coronavirus should definitely stay away from other people.
Awesome. Last question, I believe, of the evening is: I have had a hard time breathing, or you have high blood pressure and or diabetes. I can't take the vaccine, can I? Won't it make
Absolutely,
me?
please take it.
Please take it.
Please take it. Because of your comorbid conditions, you have an increased risk of death from getting COVID. So even if you came in contact with someone who was asymptomatic and you didn't know they had it, um, and you get COVID, the likelihood that you end up in the ICU or dead is much higher than someone who's healthy. I have given COVID vaccine, and every other Saturday since February, I've given up my Saturday to volunteer to give people the vaccine. Here in Mexico adjacent, I'm here in Imperial County, just 10 miles from the Mexico border. And I've given a COVID vaccine to a 99-year-old woman, um, and people in wheelchairs, my patients with high blood pressure, diabetes, people who are on cancer treatment. I've given the COVID vaccine to all those people. So it's very important.
All right. So please take it. So please
Please.
take it. They were worried about if it'll make them sick if they take
It
it.
won't. It won't. It will do you some good. It will definitely decrease your morbidity and mortality if you contract it.
So we have come to the end tonight, and we really want to appreciate this nurse practitioner, this child of God, our sister in the faith, all the way from San Diego, by the way of Philadelphia. Joanne, you have been a blessing tonight. We really appreciate you and thank you. Um, Thank you for all that you've shared tonight. You got some hand claps coming up. They they're coming in. I'm gonna try to show them, but you got people clapping and thanking God for this session. We really hope this was beneficial to you all, and that you know that, and just so I don't forget, so you'll know that. Uh, Comorbidity, because I spoke of the term, and our nurse practitioner spoke of the term, Comorbidity. That's when you have basically pre-existing conditions, more than one uh, at one time. And so we want you to be knowledgeable, informed, because, you know, again, some people are just scared. Some people are scared. They're going to they're gonna give me the shot. They're gonna give me the vaccine, and I'm going to have the mark of the beast on my forehead. No, that's not the case. I believe if Satan wanted to try that, there's other ways he could do, and I don't think he would use the pandemic. Either way, we're covered under the blood, and so so many. I'm just trying to get to the comments. I don't want to go off too fast without you seeing these comments coming in. Someone said much needed information. Someone said awesome job. Someone else said thank you so much. We appreciate you. They're still clapping.
To God be the glory. That's
Yes,
all. That's
yes.
all. I serve God by serving his people. This is what I do. This is ministry for me. This is what I was called to do, and I'm grateful for it. I might drop you in a second because I'm at work still and the lights go out because the
Hey,
clinic is closed. So I love you all, and God bless you. If you have any additional questions, I'm on social media. You can send me a message in the messenger if there's something I can do. I'm glad to do it.
awesome. Thank you so much for your time. Great information, and those that are on, they really are. I'm just grateful. We got so many people saying needed the information, and no, I know we don't want to lose you in the dark. So do what you got to do. We appreciate you. This up and coming doctor, nurse, practicing nurse practitioner, professional. We appreciate you, woman of God. Thank you so much for your time, and we'll stay in contact with you. And again, the saints are on. They, so many people, and someone even said thank you for volunteering. Praying special blessings. You are a blessing. You have blessed us tonight, and we're grateful. New Harvest Temple, nurse practitioner, we're going to let you go because we don't want you
Thank
to kick off.
you.
God bless you. You're welcome. Thank you. We appreciate you. So, everyone, we just want to say thank you for being on tonight. We want you to share. Those that haven't shared, please share this information. Please share this information. Please tag people that you know that might have had questions, might have thought certain things, might have been misguided, misinformation, and so on. We've heard from an African American sister who is a believer. So, this is what we need. And there are plenty more. There are plenty more. Dr. Zemekia Corbett, she's one. If you haven't followed her or look up her information, she's somebody good to find out the information. She's working in that field. You heard it earlier that this Dr. Corbett has been in much working with getting Moderna up and running. That's African American female doctor working in this field and it's helpful because again, within our communities, within our backgrounds, so many people said, well, this and that, and it has caused many people to die even now. And so we don't want you to be ignorant. Whatever decision you make, that's up to you. We brought the information to you, and perhaps we'll have another time that we could share again in this forum. But as you know, we're moving in different ways during this pandemic, and we will continue moving as God has blessed us. All right, so we didn't have Bible study, we did not have prayer, but you continue to open your Bible, read the Word, study it, and send in your questions even regarding that, because we're looking for an awesome time again. All right, until we meet again, Christian Empowerment on Saturday from 11 a.m. starting at 11 a.m. youth and young adults for ages 4 to 24. Get in there, get on that Zoom. It's great information, great fellowship. And then we will be back on Sunday at 12. If you have not registered and would like to register for this Sunday's service in person, please do so. If the seats are not filled by tomorrow, guess what? Guess what? Guess what? Those that attended last week will be able to jump in. Let me tell you, they ready. All right. Before we open it up to the public for the few seats we do have, and as you see, we've been sanitizing, and it's a great fellowship. Amen. So govern yourselves accordingly. And yes, Dr. Kizmikia. I don't know what I said. I know it's Corbett, but I don't know what that first name. Kizmikia. That's it. Dr. Kizmikia. Look her up. There are other doctors. One doctor I cannot pronounce, but I was looking again at this clip that I saw months ago, and great information. Great information. And be empowered, people of God. We love you. Have a good night.